One of the most terrifying things about aging in the United States is not just losing our memory, but losing our mobility, losing the ability to walk without pain, to bend, to lift, to get out of a chair without struggling. It can start small. Some stiffness in the morning. Or maybe you notice your legs feel weaker going upstairs. But that small change can spiral into permanent loss of independence. You stop going for walks. You avoid activities you once loved. And slowly, silently, your muscles shrink and your joints stiffen. By the time many seniors realize what's happening, it's already affecting their daily life, and they feel like there's no way back. The very first thing to understand is that muscle loss with aging, called sarcopenia, is not inevitable. It's common, yes, but it's not automatic. And the same goes for joint degeneration. Osteoarthritis doesn't happen overnight. In fact, both conditions are massively influenced by diet. In the United States, the standard American diet is working against our muscles and joints every single day. Too much sugar, too many refined carbs, not enough anti-inflammatory foods, not enough protein, or the wrong kind. Seniors in Canada, the United Kingdom, and Australia often face similar issues. Meals that are high in calories but low in nutrients that truly support aging muscles and joints. And this is why we need to talk about the right foods, because the right foods can literally rebuild your strength and mobility, even in your 60s, 70s, or 80s. Let's start with the cornerstone: high-quality protein. Seniors in the United States are frequently under-consuming protein, especially women over 65. The government-recommended daily allowance is around 0.8 grams of protein per kilogram of body weight, but research has shown that this is too low for older adults who are trying to maintain or build muscle. Many experts now recommend closer to 1.2 to 1.5 grams per kilogram, especially for older adults engaged in resistance training or recovering from muscle loss. This isn't just about bodybuilding. This is about your legs being strong enough to carry you. It's about preventing dangerous falls that lead to broken hips and irreversible decline. In hospital settings across the United States, broken hips in seniors are associated with up to a 30% increase in mortality within a year. That's how serious this is. You need complete proteins, those that contain all 9 essential amino acids. Eggs, chicken, turkey, grass-fed beef, wild-caught fish like salmon or sardines, and even Greek yogurt are perfect examples. If you're plant-based, it's still possible, but you need to be more intentional. Combine legumes with grains, use soy products like tofu or tempeh, and consider supplementing with pea or rice-based protein powders to get your intake up. One specific amino acid that deserves special mention is leucine. Leucine is the key that turns on the muscle-building process. Think of it as the ignition switch. Without enough leucine in a meal, especially as you age, the muscle doesn't get the signal to grow or repair. This is part of what's called anabolic resistance in older adults. Your body doesn't respond to protein as efficiently as it used to. This is why it's not just about how much protein you eat per day, but how much per meal, and the leucine content of that protein. Aim for at least 25-30 grams of protein per meal, with 2 to 3 grams of leucine to maximize muscle protein synthesis. Now let's talk about collagen. If you're over 60 and you're not consuming collagen-rich foods or supplements, you're missing a critical piece of the puzzle. Collagen is the primary protein in connective tissue. It makes up your ligaments, tendons, cartilage, and skin. Your body makes less collagen as you age. This is one of the reasons joints become stiffer, more painful, and more prone to injury. Collagen loss also weakens the integrity of your muscles, because tendons connect muscles to bones. When that connection weakens, so does your strength. Bone broth is an excellent natural source of collagen, rich in amino acids like glycine and proline, along with minerals like magnesium and calcium that support bone density. In the United States, collagen peptide supplements are growing in popularity, and for good reason. Studies have shown that when taken with resistance exercise, collagen supplements can significantly increase muscle mass and reduce joint pain in older adults. But again, consistency is key. You won't notice a difference overnight. The people who report the best results are the ones who take it daily for months. We also need to zero in on anti-inflammatory foods, because chronic inflammation is at the root of nearly every degenerative joint condition: osteoarthritis, rheumatoid arthritis, and even back pain. Seniors in the United Kingdom and Canada often struggle with inflammation-related issues, and doctors often just prescribe NSAIDs like ibuprofen or naproxen. But those drugs come with risks: gastrointestinal bleeding, kidney stress, elevated blood pressure. Instead, seniors should be loading their plates with foods that naturally fight inflammation and help joints recover. Fatty fish like salmon, mackerel, and sardines are rich in omega-3 fatty acids, specifically EPA and DHA, which have been shown in studies to reduce joint stiffness and tenderness. In fact, some trials have shown omega-3s can reduce the need for NSAIDs in people with joint pain. Turmeric is another powerful anti-inflammatory food. The active compound, curcumin, blocks inflammatory pathways in the body. But turmeric by itself is not well absorbed. You need to consume it with black pepper, which contains piperine, to increase its bioavailability by up to 2,000%. In the United States, high-potency curcumin supplements with added black pepper extract have become common, and clinical trials have demonstrated benefits for both joint pain and muscle recovery. Ginger, garlic, green tea, and dark leafy greens like kale and spinach also contain compounds that lower inflammatory markers like C-reactive protein and IL-6. The more of these you get into your daily meals, the better your joints will feel. You also need magnesium-rich foods. Magnesium plays a critical role in muscle function. It helps muscles contract and relax properly. Magnesium deficiency is extremely common among seniors in the United States, partly because of poor diet, partly due to medications like diuretics and proton pump inhibitors that deplete magnesium levels. Symptoms of low magnesium can include muscle cramps, weakness, and fatigue. Foods rich in magnesium include pumpkin seeds, almonds, spinach, black beans, and avocado. A magnesium citrate supplement may also be helpful, especially if you have trouble sleeping, since magnesium also promotes relaxation and deeper sleep, which is when the body does most of its repair work. Let's not forget vitamin D and calcium, because no discussion about joint and muscle health is complete without them. Vitamin D deficiency is an epidemic among seniors in the United States, especially those who are indoors most of the day or living in northern states with less sunlight. Without adequate vitamin D, your body cannot absorb calcium properly, and your bones suffer. Weak bones mean weaker joints, and the risk of fractures skyrockets. But vitamin D also directly affects muscle strength. In studies of seniors with low vitamin D levels, supplementation significantly improved balance, leg strength, and reduced fall risk. The best food sources of vitamin D are limited: fatty fish, fortified milk or orange juice, and egg yolks, but most seniors will need a supplement. Vitamin D3, cholecalciferol, is more effective than D2, and levels should be checked by your doctor regularly. Calcium, on the other hand, is abundant in dairy foods like milk, cheese, and yogurt. But if you're dairy-free, you can still get calcium from fortified plant milks, sardines with bones, tofu set with calcium, and leafy greens like collard greens and bok choy. However, excessive calcium without enough vitamin K2 can actually increase the risk of calcification in arteries. That's why foods like natto, grass-fed butter, and pasture-raised eggs are also important. These provide vitamin K2, which helps direct calcium into the bones and away from arteries. Another food that deserves attention for joint support is extra virgin olive oil. It's not just a healthy fat. It contains oleocanthal, a compound with anti-inflammatory effects, similar to ibuprofen. In Mediterranean countries, older adults often consume 2 to 4 tablespoons daily, and rates of joint disease are significantly lower. It's ideal for drizzling over vegetables, adding to salad dressings, or even incorporating into smoothies. Cherries and berries are also essential because they are rich in anthocyanins, powerful antioxidants that reduce inflammation and oxidative stress in joints. In fact, tart cherry juice has been studied for its ability to reduce muscle soreness and improve recovery after exercise, even in older adults. Blueberries, strawberries, and raspberries support collagen production and fight the breakdown of cartilage. For gut health, which has a direct impact on inflammation and immune response, fermented foods like sauerkraut, kefir, kimchi, and plain yogurt help maintain a healthy microbiome. A disrupted gut microbiome has been linked to increased joint pain and inflammatory conditions. In the United States, many seniors overuse antibiotics, consume too much sugar, and lack probiotics, all of which damage the gut lining and worsen inflammation. Another critical nutrient that is often neglected is zinc. Zinc plays a key role in tissue repair, protein synthesis, and immune system function. It also helps regulate inflammation, and low levels have been linked to increased pain and slower recovery from injuries. In the United States, many older adults consume inadequate levels of zinc due to a lack of red meat or shellfish in their diets, or poor absorption caused by medications and chronic digestive issues. Oysters are the richest source of zinc, but beef, pumpkin seeds, and lentils also contribute. A deficiency might not be obvious at first, but over time it can lead to increased susceptibility to infections, delayed wound healing, and worsened joint health. Now, let's talk about curing sugar addiction, because this has a direct link to joint pain and muscle degeneration. The average American senior consumes way too much added sugar through processed snacks, soda, pastries, and sweetened coffee drinks. Excess sugar promotes glycation, a process where sugar molecules bind to proteins like collagen and damage them. This makes joints stiffer and skin less elastic. It also promotes systemic inflammation and spikes in insulin, which break down muscle tissue. Seniors who eliminate or drastically reduce added sugar often report significant decreases in joint pain within weeks. Instead of sugary snacks, replace them with nutrient-dense options like a boiled egg with avocado, or Greek yogurt with berries, or even a handful of walnuts and some dark chocolate over 85% cocoa. Speaking of healthy fats, avocados are another food that should be in every senior's kitchen. They are packed with monounsaturated fats, magnesium, potassium, and antioxidants like lutein and zeaxanthin. These support joint lubrication, muscle function, and even eye health. One medium avocado also delivers over 700 milligrams of potassium, which helps maintain proper electrolyte balance and muscle contraction. Low potassium levels are linked to muscle cramps, weakness, and fatigue. This is especially important for seniors in the United Kingdom and Australia, who are often on medications like diuretics that cause potassium loss. Another highly underrated food for muscle strength and joint protection is beets. Beets contain nitrates, which the body converts into nitric oxide. This helps relax and expand blood vessels, improving circulation and delivering more oxygen and nutrients to working muscles. For older adults who often struggle with poor peripheral circulation, cold extremities, or slow recovery from exertion, this can be game-changing. In fact, beetroot juice has been shown in clinical trials to improve exercise performance and reduce muscle soreness in seniors, especially those with limited mobility. Adding cooked beets to a salad or drinking a small glass of beetroot juice before physical activity can noticeably enhance energy and reduce post-exercise fatigue. Legumes and beans, such as lentils, chickpeas, black beans, and navy beans, are packed with plant-based protein, fiber, magnesium, and iron. These nutrients are essential for energy, muscle metabolism, and reducing inflammation. The fiber in beans also helps regulate blood sugar levels, which is essential because high insulin promotes fat storage and muscle breakdown. Seniors who include beans several times a week report better digestion, steadier energy levels, and reduced joint stiffness. Combined with olive oil, garlic, and a handful of greens, beans create a powerful anti-inflammatory and muscle-supporting meal. Next, we must address hydration, because many older adults in the United States are chronically dehydrated without realizing it. Dehydration weakens muscle contraction, reduces blood volume, and makes joints feel stiff and painful. Joint cartilage is largely made of water, and without proper hydration, it starts to dry out and deteriorate. Seniors often lose their thirst response as they age and may avoid drinking water due to concerns about frequent urination. But this leads to subtle yet damaging chronic dehydration. Aim for half your body weight in ounces of water per day, and more if you're sweating or taking diuretics. Add a pinch of sea salt to your water, or sip on electrolyte-infused drinks without added sugars if needed. Another key nutrient that can't be ignored is vitamin C, which is vital for collagen synthesis. Without vitamin C, your body cannot build or repair cartilage, tendons, or ligaments. A lack of it results in slow wound healing, joint pain, and even muscle weakness. In severe cases, it leads to scurvy, but even marginal deficiency can cause problems. Citrus fruits like oranges and grapefruits are rich in vitamin C, but so are bell peppers, kiwi, strawberries, and broccoli. Include these daily to support joint elasticity and tissue regeneration. Bone health also plays a role in muscle and joint strength. Weak bones mean limited structural support, and the risk of fractures from even minor falls skyrockets. Seniors in Canada and the United States are often diagnosed with osteopenia or osteoporosis far too late, and by that time, the loss is often irreversible. Alongside calcium and vitamin D, nutrients like boron, strontium, and silicon are crucial for bone mineralization. Foods like prunes, almonds, raisins, and leafy greens contribute to stronger bones and can help slow the progression of bone density loss. Foods high in sulfur compounds, such as garlic, onions, and cruciferous vegetables like broccoli and Brussels sprouts, are essential for joint detoxification and connective tissue support. These vegetables contain glucosinolates and sulfur-based amino acids that help build glutathione, the body's master antioxidant. Glutathione neutralizes toxins that can accumulate in joints and tissues. Seniors who consume more sulfur-rich foods have lower levels of joint inflammation and better joint flexibility over time. You also need to consider B vitamins, especially B6, B12, and folate. These are critical for nerve health and reducing homocysteine levels, which when elevated can increase the risk of both cardiovascular and joint issues. Deficiencies in B12 are shockingly common in older adults, particularly in the United States, due to poor absorption with age and long-term use of acid-blocking medications. Symptoms of B12 deficiency can include numbness, tingling, fatigue, poor balance, and even depression. Regular intake of high-quality animal products or supplementation with methylated forms of B vitamins can significantly improve these symptoms. Finally, fermented soy products like natto and tempeh are not only rich in protein and probiotics, but also contain vitamin K2, which directs calcium into bones and prevents it from accumulating in arteries and joints. In Japan, natto consumption is associated with stronger bones and a lower rate of hip fractures. Seniors in the United States are often completely unaware of the existence of vitamin K2, despite its critical importance for long-term musculoskeletal health. Integrating small servings of these foods into your diet can support not only your joints, but your cardiovascular system as well. It is impossible to ignore how powerful food is when it comes to the health of our muscles and joints. Every bite either moves you closer to freedom and strength or closer to weakness, stiffness, and decline. Every food choice you make either supports tissue repair or accelerates degeneration. Seniors across the United States, the United Kingdom, Canada, and Australia are facing epidemics of frailty and immobility, but the root of the problem is often on the plate. The solution, too, starts on the plate. If you're over 60, or if you care about someone who is, these foods are not optional. They are essential for preserving the ability to move, to live independently, to stay pain-free, and to age with dignity and strength.